My name is Dennis Opondo. I'm a health manager currently working with the Kenya Red Cross, and I'm also part of the Pegasus Institute. And I'm happy to also welcome Sarah, who's been a good friend, and we've worked on a couple of projects together. So I don't know if maybe it's a good time for Sarah to introduce herself before we go into the slides.
Yeah, hi everyone. My name is Sara, and I'm a public health and policy researcher and currently doing my master's degree at Heidelberg University. I work in the area of peace and health, trying to bridge the gap between peace and health. And I look forward to sharing my experience in that field with you today, and more importantly, also to learning from you. So, yeah, over to you, Dean. Dean, you're muted. You're muted.
Okay, thank you, Sarah. Yeah, Pegasus is definitely very happy to have you on this. So yeah, we could just start on to the slide. So so today we'll be talking about medical piecework in times of conflict, and this is because we've had this talk before, and we had it sometime last year during the IPPNW Summer School that was hosted in Berlin. So from that, we shared with Gertrude, who then invited us to do the presentation on the Pegasus platform. So we were happy to take it up. So just for starters, we had this picture or the first slide that basically is a number of peace builders that we have had through history. So I'm not sure if we're able to recognize most or some of them. Some of them are from Kenya. Some of them are from South Africa. Some from India. So we do have a couple of them, and they all have their roles and the roles that they have played within peace work, not necessarily medical peace work, but they have had some sort of contribution towards peace work. So we have Mwangari Maathai on the bottom left corner, uh, bottom right rather. We have Nelson Mandela on the bottom left, and then we have Allah, Salah in the middle, and we have Malala, Yusufia on the very top, the biggest picture, and then we have the famous Muhammad Ali and Mahatma Gandhi. On to the next slide. So basically, how we're going to take you through this is we're going to define what peace is, what conflict is, and then bring in the aspect of medical peace work. Then we're going to look at the core objectives of medical peace work, the effects of conflict on health systems, and then a bit on forced displacement. Then we're going to delve into the role of healthcare professionals in peace work. And then finally, we're going to take you through a case study in Sudan by our very own Sara. And then a bit of a practical activity based from Uganda, Kenya, and Congo. So, yeah, of course, I'm sure with the kind of audience that we have, these are definitions that have probably been made over and over, but it doesn't hurt to go through this again. So it's good to understand what peace is. So basically, from this, I would say peace simply is the ending or absence of war, but it can be broadly defined as a state of quiet within the community, or freedom from oppressive thoughts, or harmony in individuals and social relations. But definitely, peace can be more than that, especially in the historical context, where words like salam and shalom have been used to mean a state of well-being or state of spiritual peace and wholeness. Uh, Peace can also be defined as a state in which people feel safe, which makes it a very subjective term. So we can have positive and negative peace. Basically, negative peace would mean the absence of violence, and then positive peace would not just be the absence of violence, but it's more towards the constructive handling of conflict and the buildup of peaceful structures and a culture of peace. This is how Jane Galtung has previously defined peace. So, all in all, we can say peace is not merely the absence of violence, but a state of mutual, beneficial relationships, fair structures, and a culture of peace. And it's also a capacity to handle conflicts with empathy, creativity, and by non-violent means. So that takes us to now what is conflict? Basically, conflict is a serious disagreement or a clash that can occur between two parties who have incompatible goals or desires. Conflicts occur at different levels, and this could range from as low as interpersonal conflict to international conflicts or interstate conflicts, which is going to be our focus today, as this usually involve political parties, armed forces, lobby groups, NGOs, INGOs, and during which conflict resolution efforts usually take place. So, in an activity that we would call peace building within the medical peace work framework. So that takes us to now what is medical peace work. So medical peace work basically focuses specifically on the roles of healthcare workers in these settings. Healthcare workers do have a significant role in peace building, but in some cases, they've also intentionally or unintentionally become perpetrators of conflict. And this can be, as we said, it can be intentionally through abuse of power or through neglect or through omission, and unintentionally by just being part of the violent structures, which we are going to go over critically in the next few slides. So, next slide, please. So yeah, we have gone through what medical peace work, which basically is a transdisciplinary field that integrates health work, uh, violence prevention, and peace building. And it leverages on the unique role of health professionals to assess the health impact of violence and conflict while promoting peace through health interventions. So it's also good to understand the core objectives of medical peace work, which basically we're focusing on four. One is impartiality, humanity, neutrality, and independence. So for impartiality is basically for prioritizing needs from the ones that are most urgent and the ones that needs to be addressed first without making any distinction. And for humanity, just by virtue of value of human life. So you protect lives and dignity, as well as maintain respect. Neutrality, humanitarian actors do not take sides during conflicts, and independence, where there's not subordinated, they are not subordinated to the objectives of the hostile parties. Next slide, please. So, of course, it's good to understand the conflict, the effects of conflict on health, so that we can understand how best we can be valuable as healthcare workers in peace building. So, conflicts does have a range of effects on health systems. This could be direct and indirect effects. So, for direct effects, usually involve direct injuries, physical trauma, loss of life, forced displacement that include refugees and internally displaced people, and of course, which we are going to talk more about. It also involves destruction and looting of homes, different facilities, including health and educational facilities, overtaking of facilities by combatants, gender-based violence, forced recruitment of male and into the armed forces, and sexual assault and exploitation. There's also targeted attack on civilians and medical workers, which we've actually seen in the recent past with the global tension in various parts of the world. So for indirect effects, this usually the health concerns that come about as a result of conflict. So it could be famine, malnutrition, and food insecurity, lack of healthcare services, usually due to shortage of medication or closure or destruction of health facilities, displacement of healthcare workers. So indirect effects could also include increased maternal and child morbidity and mortality, trauma and mental health concerns. Of course, it might also lead to outbreak of infectious diseases, which unfortunately I'm dealing with at the moment. Inappropriate management of chronic health conditions and such as hypertension, diabetes, which now there's a lot of focus that is being put in terms of management of non-communicable diseases in a humanitarian setting. So next slide, please. So next, we just want to also understand what forced displacement is. So according to a definition from the UNHCR, forced displacement usually occurs when individuals and communities have been forced or obliged to flee or to leave their homes or places of habitual residence as a result of or in order to avoid the effects of armed conflict. This could be generalized violence, could be human rights abuses, could be natural or man-made disasters, or development projects. And this it both includes situations where people have fled, as well as situations where people have been forcibly removed from their homes, evicted or relocated to another place, not by their choosing, whether by the state or non-state actors. So the defining factor is usually the absence of will or consent. However, this does not mean that only displaced people suffer from the consequences of conflict, but also individuals can be affected by conflict even without being displaced from their homes. Populations that do not move away from nearby conflicts are often poor or vulnerable, and this usually has an increased risk of mortality and morbidity due to direct violence from the deterioration of the local condition. So what would you say are the impacts of forced displacement conflict on health? So according to International Organization of Migration, IOM, hazardous traveling conditions, overcrowding, limited access to proper hygiene and sanitation can increase a migrant's vulnerability to disease, particularly communicable disease. Yet displacement can be exacerbated can exacerbate the burden of non-communicable diseases, as I had mentioned. And during displacement, there's also limited access to healthcare throughout travel, and also delaying diagnosis and depleted medication. So this is on an individual level. So what about health systems? So forced displacement does have a bearing on health system. Usually, infectious diseases outbreak due to reduced sanitation and hygiene practices, and poor living and housing conditions is usually one of the ways in which the system is burdened. There's also trauma and psychosocial support, where so many people are seeking this kind of healthcare or mental health related care, but they cannot find because the facilities are not enough. So there's also increased need for maternal and reproductive services, again, just because the health systems are strained, and the same to non-communicable diseases. So this means that increased needs and patient loads on hospitals and healthcare services usually leads to a strained health system of the host region, so where they're going to seek refuge. Furthermore, so more conflicts usually occur in low to middle income countries where systems are already struggling. And this just makes the whole situation to become a compounded crisis. Next slide, please. So what are the roles of healthcare professionals in times of conflict? So one way in which healthcare workers can be useful, especially in times of conflict, is they are frontline responders. They are the ones who are possibly going to be helping those who are injured. They're the ones who are going to help the mothers who are pregnant, who are due for delivery and all that. So they are the ones who receive most of these people who have been displaced for these basic services. The other way is they can also be peace builders, meaning that healthcare professionals can contribute to peace building in several ways. One, they could promote dialogue between the rivaling communities, because whether the rivaling community or both communities are usually going to come for some health service at some point. So healthcare workers do have a role in promoting dialogue between the two. Also, how they are peace builders is they do deliver healthcare within the conflict zones, and that means that they have a role to ensure that there's an understanding of peace and the importance of peace. So that's also a role that they will take up. Additionally, healthcare workers sort of build trust between the rivaling parties, and also they have a role to engage in peace advocacy. And finally, because research and policy development is important to help in developing the peace professionalism, it's also very important that healthcare workers understand that role. So healthcare professionals also need to practice self-care, meaning you should not throw yourself in the line of fire just because you're a healthcare worker. So always as a healthcare worker, the priority is to put yourself first. Next slide, please. Of course, we can't fail to mention that healthcare workers can also be perpetrators, as we might have implied earlier. So there are various ways in which healthcare workers can be perpetrators. It could be intentional, it could be unintentional. This is by active participation in the conflict itself, underreporting and non-documentation or misreporting, injuries and deaths or that kind of thing. So that's how healthcare workers can also become perpetrators. And healthcare workers could also be discriminatory and selective in their treatment if especially they decide that we'll not treat this party because they've done this and we'll treat this particular group because they are the innocent ones. So in the value of the core principles of no taking sides, it's very important that the health workers are not discriminatory or selective in their treatment. Medical justification of genocide. So healthcare workers cannot decide who needs to die and who doesn't need to die. So that is not their role as a healthcare worker. You cannot pick that side, and that's not their choice to make. Destruction of evidence or medical reports. This has been seen in various um, situations where evidence was destroyed, evidence that would possibly help in maybe getting the perpetrator to justice or something of the sort. But healthcare workers who've helped with this have also been perpetrators in a way. And also, more importantly, is a breach of confidentiality, where patients' confidentiality has not been kept and has led to either more injury or death of a patient. Uh, Next slide, please. So I think from this point, we'll dive into the Sudan case, where I know Sarah is well informed of this. So I'll leave it over to you, Sarah. Thank you.
Thank you so much, Dean. So now we're gonna have a closer look on how to bridge health and peace, taking Sudan as a case study. Um, so just before we delve deeper into the context of Sudan, let's just go over the definition of conflict again. I'm sure you guys already know what conflict is. I mean, from Dean, thank you very much. But let's just define conflict again. So just at the very basic definition, conflict is just a disagreement or having different opinions between two people or individuals in the same group or in different groups. So it just refers to a disagreement. But then, if we want or if conflict escalates, it can refer to a disagreement where physical force is used, and in that case, we call it a violent conflict. And if it escalates even further, where we have a disagreement and a confrontation that is armed between armed groups, military or paramilitary groups, in that case, we call it an armed conflict. Um, there are lots of armed conflicts around the world. We can see now the conflict in Ethiopia. There's also the conflict in DRC, Democratic Republic of Congo, Ukraine, Yemen, Mali, Syria, Palestinian conflict in Myanmar, and also Sudan, which is going to be our case for the day. That's a pretty tragic world we live in, isn't it? So, just to give you a bit of context of where Sudan is, Sudan is a country in Northeast Africa and its capital is Khartoum. As of 2023, the population was just above 50 million. And as of 15th of April 2023, a fighting broke out in the capital city in Khartoum. And that was as a result of a vicious power struggle between the military group and the paramilitary group, leading to lots of consequences regarding health. So, the first one would be the forced displacement. This is a phenomenon that we see in every conflict that happens everywhere. So, just before we start speaking about the displacement in Sudan, previously, Sudan has hosted 1.1 million refugees in 2022, as of 2022. But after the conflict began, more than 12.5 million people were displaced either internally or externally. Um, they migrated internally within the safer states and externally to the neighboring countries, such as Egypt, as we can see here in the picture, such as Egypt, Chad, Central African Republic, South Sudan, Ethiopia, and then also further down to Uganda and Kenya as well. So unfortunately, this was the or one or the most devastating humanitarian displacement crisis in the world. And you can imagine that this was a huge or a massive displacement that is equivalent to the entire Swiss population. So we just said that more than 12.5 million people were displaced, and you just look at the Swiss population, that's just above 12.5 million. That's the entire population of Sudan that have been displaced. So that's a massive humanitarian crisis. And then we look at the other consequences on the health system. I'm not sure if everyone here is familiar with what a health system is, but let's just kind of explain that very briefly. A health system is an organization of all the institutions and resources who have the same goal of promoting and sustaining health. And a health system has six building blocks, as we can see right now here. All of these come together for the sake of improving the health and well-being of people. So let's just go quickly over the building blocks. Those are the medicines and technologies, health information, health financing, service delivery, human resources, leadership and governance. And we can see that when we speak about Sudan's context, the healthcare infrastructure has been totally devastated. And again, Sudan conflict leaves health system in total collapse. So there was a destruction of more than 70%, and recent statistics actually say more than 80% of the hospitals have been destroyed. They're non-functional, and the supply chain of medicines have also been disrupted, leading to a spread of multiple infectious diseases such as cholera, malaria, dengue. The health financing system is also unfortunately non-functional, leading to higher out-of-pocket payments and thus, financial inaccessibility of healthcare services. So it's a very tragic situation that is currently happening when we speak about the healthcare system in Sudan. Um, but how do we apply the concepts of medical peace work in terms of bridging health and peace? So, as my colleague Dean mentioned, peace very simply is a state of tranquility. Sorry. So it's basically the absence of disruptions, which when we speak about it in the health realm, we refer to that as a state of absence of diseases. And that is also a state of health. And health is a state of well-being and the absence of disease or infirmity. So when we say that we want to achieve peace, that means we also want to have a state of well-being, right? Because we are now at a state of tranquility and a state of absence of disruption and absence of diseases. So this is how we link health and peace. And then we can see that it's a bidirectional relationship. So when there's no peace, there's no health. Because as we've seen in the example of Sudan, war destroys hospitals and therefore diseases spread because, well, there's also displacement, there's destruction of hospitals, there's low sanitation and hygiene. So there's no health, which essentially means that there's no peace. And also when there's no health, there's no peace because when people are sick, they're struggling, they fight over resources, and this leads to no peace. This leads to conflict. And this is how we can bridge both health and peace. I hope that's clear for everyone. Now, medical peace work comes as a superhero, And it says we can use medicines not to just heal bodies, but we can also heal communities and we can stop violence in that way, as we just mentioned. So let's see how healthcare professionals in Sudan have been contributing to achieving peace. They've been delivering emergency medical care, they've been delivering mental support, mental health and psychosocial support, nutrition and maternal services, and disease surveillance and outbreak control, and also mobile clinics, telemedicine, and remote care. So, the most innovative interventions, in my opinion, that I've seen really functional in Sudan are the mobile clinics and telemedicine, and that's why I chose to sort of focus on those and explain them a bit deeply. So, mobile clinics have been established in Sudan in the current times of conflict. But to just explain what mobile clinics mean, I'm going to show a video. It's not in Sudan, it's in Kenya, but it explains to you how mobile clinics actually function. So I'm just going to play the audio. I hope that also everyone will be able to hear. Let me share the sound also. Okay.
Kenya's Turkana County is among the regions hardest hit by the prolonged drought. Access to healthcare in these counties' remote areas is often difficult. But Save the Children Kenya has created containers, popularly known as community pharmacy boxes, to treat some illnesses at home.
It has helped a lot because it reduces the movement of people going to the hospitals. Now they can get medicine very close to them. They are happy, and so are we, because we used to have to refer them to hospitals daily.
The health workers have set up outreach programs every fortnight in the communities. Ewoi Erpan, a mother of 3, has brought her children for treatment. She says one died last year.
The child was sick. The only problem we faced was the distance to the health facility. He died while we were taking him there.
Yeah, so that gives us a general idea of what mobile clinics are and their importance. They ease access to healthcare, and of course, in times of conflict where there's destruction of healthcare facilities, there's a disruption of the supply chain of medications, access to healthcare can become very difficult. Um, yeah, so access to healthcare can become very difficult, and when there's mobile clinics, people that come to people who are in need of care, this could be very beneficial. So in the
Kenya's Turkana
no, in the context of Sudan, UNICEF has really very much helped in establishing mobile clinics and also concern. You can see that, they can either establish a tent or they can just drive in their trucks to deliver the healthcare services. So, and then our next innovative intervention would be telemedicine. This is again a video from South Sudan. It explains what telemedicine is and how it can be used. So now let's just look at the video and then maybe you can write in the chat after the video why telemedicine would be important in the context of Sudan.
I just came back from South Sudan where I worked in a town called Awil for the last 9 months where MSF runs a mother-child hospital. It's a really remote area when telemedicine really helped us out with providing improved patient care. One particular example was a pregnant woman that came in. She was about 6 months pregnant and she was extremely short of breath. She needed oxygen and we needed to help her right away. We did an ultrasound of her lungs and her heart. And in her heart, we thought we saw a problem with one of the valves, but none of us are cardiologists. So what we did is we sent the ultrasound clips to the telemedicine doctor in Canada, who then sent it off to a cardiologist in the US, and he diagnosed what's called mitral stenosis. This is a really dangerous problem, especially in pregnancy, and many women die of it. And we talked with our specialists in Paris, who was an anesthesiologist, and our obstetrician specialist in Australia to make a plan. And what they recommended was that we do an elective C-section, but also that we recommend a tubal ligation for her, because any further pregnancies and with this heart disease, she could have a higher risk of death. And in a country like South Sudan, where women are expected to be childbearing, this is a really aggressive recommendation to give to a patient. And if we didn't have the support of telemedicine and the confirmation from a cardiologist that in fact it was this valve disease, we wouldn't have had the confidence to give her this recommendation. She agreed to have the C-section, and in fact she had agreed to have the tubal ligation. And she went through the procedure, she did wonderfully. The whole team did really well with the procedure, and she ended up having a beautiful young girl.
So maybe in the chat you can also just mention briefly why would telemedicine be important in the context of conflict? What are your thoughts? Telemedicine can also ease access to healthcare. In times of conflict, usually we have a shortage of healthcare workers, and we might also have a shortage of specialists as well. So when we are in a conflict zone, we might not find doctors to speak to. So does that mean that we leave the patient? No. So what we do is we deliver consultations as healthcare professionals from abroad. So it doesn't have to be a doctor that is stationed in the conflict zone or even within the country, just as in the case of South Sudan, they communicated with a doctor who lives abroad. So that also eases the access to healthcare. Yeah, supports timely care close to home. Exactly. So in Sudan, this has also been implemented. And, ooh, no, not again. Moving forward.
I would just
Exactly. So physicians also did teleconsultations. They weren't really stationed in Sudan. Some of them were even stationed in other states, but delivered consultations for those who are working on ground in conflict zones. And some of them also worked from abroad and also delivered teleconsultations. So that's a really innovative intervention that can really help in times of crises. So, I hope this was taking the theoretical knowledge that we just gained from the beginning and contextualizing that. I hope that helped in understanding how we bridge health and we bridge peace and health. And now we thought of making this a bit more interactive and giving you a practical activity. Over to you, Dean, to introduce the activity, please.
Sarah, I think I have a very clear picture of how conflict has affected the health systems in Sudan, and I hope that's everyone's field. So yeah, on to the practical activity. So Kalobeyei Integrated Settlement is where I am, and we are based in Kenya, where I work. So the Kalobeyei Integrated Settlement, situated in northern Kenya, has recently seen a significant influx of Congolese refugees fleeing from the political unrest and violence in their homeland. The sudden arrival of refugees has strained local resources, leading to health crisis and rising tension between the host population and the new arrivals. Then there is a contagious disease outbreak, which specifically is cholera, has been reported in the refugee camp, and there's growing concerns about malnutrition and mental health issues among the refugees. Local health facilities are overwhelmed, and there is a pressing need for coordinated efforts to address the health needs of both the refugee and the host community, while also promoting peace and reducing tension. So I'm not sure if we'll do this in groups, but in groups discuss the roles of the following stakeholders. So, so the roles of healthcare workers in this, local authorities or community leaders, NGOs, INGOs, and international community, and then the refugees themselves and IDP representatives.